keep in mind that some of the data that we see early in the week can be lagged a little bit behind weekend reporting. So I wouldn't overinterpret that decline that we're seeing with this first few days of data this week so far. But overall, we do continue to see a general increase in cases and certainly seeing the same thing with hospitalizations in the state. But of course, as always, we do see variability in these trends across the state, certainly by region, as we've seen throughout the pandemic, but also based on risk status of individuals. So based on vaccination status of individuals and also based on age group. And I want to share some of that data as we walk through the slides today. Next slide, please. So this figure is showing you that same 7-day moving average trend, but looking at the data by age group. And so what will stand out to all of you today in looking at this data is that we have seen a pretty rapid rise in pediatric case rates. So note that the rate that we are seeing in 6 to 11-year-olds is actually the highest that rate has been since the beginning of the pandemic. Similarly, we have seen rates in that 12 to 17-year-old group that have been this high before. But right now, I think what stands out to me is that our children, so children 6 to 11 years old and 12 to 17-year-olds are really where we're seeing the highest rates of disease transmission in the state. And again, this is really the first time in the pandemic that we're really seeing this high rate in our younger children. This trend began in July, so before school began. And certainly we know that school transmission is contributing to increasing rates here, but we saw this trend, of course, before school started. And so I want to just talk about strategies for our kids right now, because I think at this point in the pandemic, our children that are unvaccinated really are at higher risk than they've ever been in the pandemic. And so this is a concerning trend that I think should be notable to all of us and certainly to parents right now. Masks in school have certainly received a lot of attention in recent days, and obviously masks in schools are an incredibly important intervention. But masks outside of schools are also incredibly important and something that we need to be keeping in mind as our kids are out and about. Those of us that are vaccinated might feel more comfortable being out and about, but we need to remember that our children that are too young to be vaccinated continue to be incredibly vulnerable, more vulnerable than they've been in the past, unfortunately. And so while we are, recognizing this increased risk in our children, we need to be taking additional precautions. And so now would really not be the ideal time to be bringing unvaccinated children to large gatherings, and keeping in mind all of those things that we were really doing to protect our kids a year ago. All of those social distancing strategies, those things continue to be important now. But also back in schools, obviously this isn't just about masks in schools, and our school guidance talks to a layered approach. And so all of the strategies we've been using, masks, hand washing, distancing, ventilation, testing, and we're going to talk more about testing today, continue to be really important. And of course, the most important intervention we have continues to be vaccines. Next slide, please. Turning our attention to hospitalization data. So we do continue to see a pretty rapid increase in hospitalizations here in the state. So 796 hospitalizations, that does exceed our spring wave of illness, certainly not yet approaching that fall wave of illness that we saw, but certainly a concerning trend that we're seeing in Colorado. Next slide, please. This is a slide that shows you the difference between hospitalization counts among our adult population and our pediatric population. And so certainly we continue to see that the overwhelming majority of our hospitalizations are occurring among adults. And I'll show you some data that demonstrates that really most of those hospitalizations are occurring among unvaccinated adults. But we have also started to see a recent increase in hospitalizations among our children as well. And if you go to the next slide, you can see some of those trends more recently. So this is based on some data that we just started collecting in a different way from our hospitals across the state. And you can see a clear increasing trend here in our pediatric associated hospitalization numbers. Those numbers continue to be small. So the number here is 7 children 0 to 17 years of age that are currently hospitalized with COVID-19. But if you go to the next slide, unfortunately, this season, what we are experiencing with severe illness in children is not going to be just associated with COVID-19. We already are starting to see other respiratory viruses circulating, and this is pretty different from what we saw last year. So I want to talk a little bit about RSV, or respiratory syncytial virus. This is data that our colleagues at Children's Hospital Colorado have provided to us. And if you look at the far left of this figure, you'll see a green line, and that is showing you RSV cases at Children's Hospital for 2021-22 and comparing them to previous seasons. And what stands out in this figure is really the timing of this increase. Typically, RSV is a respiratory pathogen that we see in the winter time. So we typically start to see increases sometime in November, December, a peak typically around February. And unfortunately, we're seeing a really rapid rise in these cases of RSV. And then this is a virus that can cause severe illness in children, especially very young children, and result in high hospitalization rates. At the same time, we're also concerned about what this fall could look like as far as influenza. We have started to see some influenza cases in the state. And so unfortunately, I think what our children are going to face this fall is not just the challenge of COVID-19, but also the challenge of RSV and influenza. Next slide, please. Finally, I wanted to just share some of this data that looks at hospitalization rates among our unvaccinated population versus our fully vaccinated population. And we continue to see much greater risk of hospitalization among Coloradans that are unvaccinated. Again, while we have seen with the Delta variant some decrease in vaccine effectiveness, overall, it does appear that the vaccine effectiveness associated with prevention of severe disease continues to be high. And again, we see that individuals who are vaccinated are largely protected from severe disease, protected from hospitalization and death. And that obviously continues to be a really important message that the vaccine continues to be highly effective, especially at preventing severe disease and illness. And with that, I'll hand it over to Director Bookman. Thank you.
Thank you, Dr. Hurley, and thank you all for joining today. I want to give a quick update on where we stand statewide with hospitalizations and hospital capacity. And the top line message here really is that while hospitalizations are continuing to increase during this wave of the pandemic, we do still have a significant amount of hospital capacity available in the state. As of yesterday, we were right around 800 people hospitalized in Colorado with COVID. Again, as a reminder, our peak in December of last year was 1,800 concurrently hospitalized patients. And so we do still have significant capacity. Looking at our ICU beds, approximately 20% of the ICU beds in Colorado are still available to treat COVID and non-COVID patients. More than 20% of our medical surgical beds are available to treat COVID and non-COVID patients at this time. As Dr. Hurley indicated, as we've seen more and more cases in our pediatric population associated with the Delta variant, we have begun collecting information on our pediatric capacity. What we know is that statewide, there are more than 900 pediatric beds available. A smaller portion of them are pediatric intensive care unit beds. As of today, there are 28 PICU beds available. There are more than 150 neonatal intensive care unit beds available, leaving several hundred additional pediatric beds available for the state of Colorado as needed. We know that ventilators are one of the tools that are used to treat patients with COVID when they are hospitalized in severe cases. And we have been monitoring ventilator utilization since the beginning of the pandemic. And at this point, more than 60% of the ventilators that are in Colorado are currently not being utilized. So we have significant ventilator capacity available in the state. Next slide, please. And so just want to revisit, our statewide percent positivity and really look at it over the course of the pandemic. As testing has become more and more available, we have a better sense of really where we stand with case rates, and percent positivity is a great leading indicator of where things are headed. Our goal, as established by the World Health Organization, has always been to keep percent positivity below 5%, meaning that we have a good sense of where all cases are and have the ability to keep everything under control. You can see that our percent positivity has been going up since the middle of the summer. As of today, our 7-day average percent positivity is 6.22%. And on the next slide, I really want to take this moment to remind all Coloradans that, we currently have 97 community testing sites available throughout the state. Testing is an absolutely critical part of keeping this pandemic under control within Colorado. For all people who feel symptomatic, for people who are exposed to confirmed cases of COVID, we recommend testing. And we certainly want to make sure that all Coloradans understand where all of our community sites are, and that capacity exists and that they are free and available to everyone. We also are looking at what our testing capacity is to ensure that we can meet any surge in demand. And at this point, while we conducted 51,000 tests last week, we are still only using approximately 17% of our daily testing capacity. We can do more than 30,000 tests a day in our community sites. And we just want to make sure that all Coloradans are reminded that testing is still an important part of our layered strategy in controlling the spread of this virus. And with that, I'll take the opportunity to pass this over to Sarah Hama, who leads our community testing programs, to talk a little bit about K-12.
Hi, everyone. My name is Sarah Hama, and I want to talk to you a little bit about school testing today. And so I'm going to give you a program overview of the program, talk a little bit about the details, and then walk through what the process is for schools to enroll. So we can go to the next slide. So CDPHE is providing a free and voluntary COVID-19 testing program that is available to all K-12 schools within the state. This program is available to both staff and students, and this is regardless of vaccination status or presence of symptoms. And our goal with this program is to decrease the spread of COVID-19 within our schools by trying to identify symptomatic and asymptomatic spread as quickly as possible. By achieving this goal, we are aiming to ensure students can continue in-person learning as safely as possible, and then also minimize the number of disruptions to in-person learning from disease transmission. As Scott was saying, testing and screening testing is a very important tool that we have to help prevent and mitigate the spread of COVID-19. Next slide. So to talk about the program a bit more, this program utilizes weekly testing, and it is using rapid antigen tests. The weekly cadence of the program allows schools and districts to have a more proactive monitoring on the amount of disease spread happening within the schools. And so our goal is really to provide all resources that are necessary to the schools and districts in order to implement weekly testing. And we're doing this by providing two different options. So one is the full service model, and this is really meant to be an end-to-end testing program. And so the state has contracted vendors to provide all of these resources. And this includes the staffing to implement the testing and collect swabs, the technology and content to collect parental consent, all of the testing supplies, and does the reporting on all tests collected. So our goal of this one is really to minimize the amount of effort from and responsibility on the school to implement this program. The direct ship model is very similar with the removal of the staffing aspect. So the direct ship model still provides all of the supplies and the resources, but it is the school or the district that can provide the personnel to implement the program and collect those samples. This was we wanted to give these two options based on feedback and some stakeholdering we did over the summer to ensure it fits the needs of as many schools as possible. You go to the next slide. So I just want to walk through a bit what it looks like from start to finish for a school or a district to participate in this program. And so while these steps are laid out in a linear fashion, these are overlapping and some can happen simultaneously. So when we talk about schools enrolling in the program, I'm talking about these two dark gray boxes. And so there's kind of a three-step approach for a school or a district to enroll. First is a superintendent gives their approval or opts in their entire district. So this allows for leadership to have cohesion and understanding of what is happening within their schools. And so once we have student superintendent approval, we work with either the district as a whole unit or a subset of their schools or an individual school within their district to gather all the information we need to implement testing. So this is a Google form and a memorandum of understanding. Once we have those pieces all sorted out, we move on to step 3, in which the school or the district, depending on if they're an individual or working as a unit, will be matched with one of our testing vendors. And this is step 3 is where we really work out all the nuts and bolts of how do we get testing up and running. We expect this to take no more than 2 weeks or 10 business days from that time where you are fully enrolled till we have testing in the school. Step 4 is that individual choice where parents give parental consent for their student to be tested. Parents can opt in and out at any time of the program, and this happens on a continuous basis. And then steps 5 and 6 are our vendor showing up at the school, or if it's direct ship, getting the supplies and access to the school and starting testing. So this will happen on September 7th or any day following. So that will happen on a rolling basis based on what the school or district is looking for. And then we will continue testing throughout the school year on a weekly basis. So just to talk numbers real quick before I hand it off. So we have 447 schools who are somewhere within this process between steps 1 through 6. Of those 447 schools, that comes from 22 school districts, as well as private schools and our charter school institute. And then we have 80 of those schools who are on step 3 or beyond. So when we say fully enrolled, that means they are working with our vendor to operationalize that testing. So I will stop there.
All right, thank you everyone. We're going to move to the media Q&A portion of this morning's Avail. Just a couple of reminders. We can use the raise hand function. Those of you who did raise it earlier, I have you in the queue already. And we're gonna go ahead and start with first questions. If we have time to circle back to follow-up questions, we will. But we wanna make sure everybody gets a chance to ask their first question. If you have a question on a topic that was not covered on today's Avail, please email us at media_info@state.co.us. And when we call on you, if you could please list your name and outlet and make sure that you don't have any other open tabs auto playing any audio while you come on. So we'll go ahead and get things started with Mark Salinger, please.
Hi there, this is Mark Salinger with 9 News. With the news this morning that was released by the governor's office that 75% of the state has now been vaccinated with at least 1 dose, and the news yesterday released by the state that 30% of healthcare workers are still not vaccinated, do you worry that yesterday's decision by the State Board of Health to mandate vaccines for healthcare workers will lead to staffing shortages?
Scott, I'll take that question. This vaccine is the ticket out of this pandemic. It is safe, it is effective, it reduces the risk of hospitalization, it reduces the risk of death. And we need to ensure that our most vulnerable are protected. And that includes having healthcare workers vaccinated. And while we understand that there are concerns around staffing, this prioritization is absolutely critical to ensure that we keep our most vulnerable safe. We will continue to partner with our healthcare providers to evaluate any staffing issues that they have in the short run. We really just want to remind all Coloradans how important this vaccine is, and that it is free and that it is widely available.
All right, let's go to Meg Winger.
Hello, can you hear me all right? Okay, you can? Great. This is Meg Wingeter from the Denver Post. I had a question about on the graph showing the different age groups. It seemed like, starting in July that kids were kind of rising in tandem with adults with the overall increase in cases, but that those last few weeks they had kind of diverged, which, I mean, to me, just looking at it, looks like it might coincide with kids going back to school, but am I seeing that wrong?
This is Rachel. I can take that question. So part of what we know about viral spread is this, we do see this rapid acceleration that can occur with viral spread where we see the rate of increase week by week. We use this term exponential transmission. And so it's not uncommon to necessarily see that curve start to bend up and become more steep. But we do know that there are probably lots of factors that are contributing to increased transmission. Certainly, we were starting to see those increases in July before school started, and talked to our local public health partners about factors that have contributed. And there's been a variety of things. They have reported to us that travel, camps, sports, all of those types of things potentially have contributed. But we do know that transmission, especially with a more transmissible Delta variant that we have across the state right now, in schools is possible. And we know that that could be contributing to the amount of transmission that we are seeing among children, especially our unvaccinated children.
All right, Dan Beatty.
Hello, Dan Beatty with KRDO News Channel 13 down in Colorado Springs. So yesterday it was revealed that School District 49 has suspended classes at Patriot High School in El Paso County and are reverting back to e-learning. The district says this was done because of multiple infectious diseases present in the community and a shortage of available guest teachers. El Paso County health officials tell us they had no idea this decision was being made. Was the state notified that the school would be suspending in-person classes? And is a school district required to inform health officials they're about to shut down classrooms due to a health risk in the community?
This is Rachel. I can take at least part of that question. So what is reportable here in Colorado are cases and outbreaks of infectious diseases that are on our reportable conditions list. And that does include COVID-19. It would include really all outbreaks occurring in school type settings. And certainly it is the responsibility of school officials, school leaders to report those cases and outbreaks to public health. And that can either be to state public health or to their local public health officials. I don't know the details of that specific outbreak to comment on that. I think typically the way that school outbreaks are investigated is a partnership between the local public health agency and the individual school. So I don't have a ton of details on that. I believe it's still being investigated.
But if they are going to suspend in-person learning for a period of time, should health officials be notified in any sort of capacity? If the reason is a health risk.
So what is reportable is outbreaks and individual cases of reportable diseases. I don't believe there's anything in particular in regulation or statute about school closure, but certainly it would be in the interest of public health and a community for public health officials to be aware of widespread transmission of one or multiple diseases in a school setting.
Thank you, Rachel. One final question. Now, we've been contacted by...
Dan, we're gonna have to move on so we can make sure to get everybody's first questions in here. If we have time to get back to another follow-up, be happy to bring you back in towards the end. Let's move to Gabrielle Franklin.
Hey everyone, this is Gabrielle from Fox 31. You all placed a big emphasis on testing today. When it comes to stopping the spread among kids, is that the single most important thing that parents can be doing right now with their school-age kids? Or is it masking or sticking to cohorts or something else?
This is Scott. Rachel, you want to take that one?
I think we can both take it. Sure. So, it really isn't just one of the above, it's all of the above. We, in our approach in our school guidance, and honestly, our approach for communicable disease transmission in general is multiple disease control strategies. You've heard us talk about the Swiss cheese model of controlling disease transmission. And so it's masks, it's obviously first vaccines, right? After vaccines, it's all of the other strategies. So it's hand washing, it's testing, it's ventilation in places, it's all of those things really combined are what is going to give us the best chance at slowing disease transmission and preventing widespread outbreaks from occurring.
All right, Erica.
Hi, this is Erica Meltzer from Chalkbeat, and my questions are more about the school testing. The number of schools that you named versus the number of school districts, are you getting more interest from sort of independent charter and private schools? And what have been some of the reasons that school districts have maybe been less interested? And I'm also curious about the availability of testing. We've seen some national reporting about shortages of the rapid tests, and I'm wondering if you're going to have enough tests for for a large number of schools to be doing weekly testing.
Sure. This is Sarah. I can take that question. I'm going to take it in pieces, so I might need you to repeat the third part there. So just to repeat the numbers, we have 447 individual schools, and that comes from 22 school districts. And I would say that is the bulk, where we have some large school districts with many schools participating, as well as the Colorado Charter School Institute, which makes up all of our independent charter schools. And then we do also have smaller school districts, as well as private and independent schools. And so it really is a mix. We aren't seeing any specific trend on who is choosing to use this program or not. Can you repeat your second question?
I was wondering what some of the reasons are that we have 178 school districts and you have 22 school districts participating. So I was wondering what some of the reasons are that school districts are not participating. And then I was also wondering about availability of tests or the supply side.
Yeah, so I don't have specific data on that. We don't collect why someone chooses to not participate. We have some theories that there are other programs available within the state that aren't state funded. And so school districts may be utilizing some of those programs. We also have distributed significant amount of supplies to schools. And so schools could be choosing to implement their own programs with supplies they have on hand. And they may also be choosing to utilize some of our other testing resources available to the communities across the state. So community testing sites, or using pharmacy testing, et cetera. So I don't have a clear answer on that, but that is our best hypothesis. We also anticipate continued increase in the number of districts opting into this program as more time goes on. Your last question about testing supplies. And so we are monitoring the situation closely and really keeping track of supply chains throughout the country. We do have a significant stock of supplies on hand, as well as our vendors have test supplies on hand as well. And we also are putting in place orders for additional tests and also have a variety of testing resources available to us with the intent of mitigating our risk. So while we are watching it closely, we do not feel that there is an imminent risk to our supply chain right now.
All right, Chris Vanderveen.
Chris Vanderveen with 9 News. I'm looking here at your chart when it comes to cases of RSV, and based upon that chart, it looks as if your case rise in RSV cases in the state of Colorado is now 20 weeks early. What's going on here? What can explain that very sharp rise in RSV this early at a time when you've pretty much over the last 10 years never seen anything like that?
Sure, this is Rachel. I can take that question. So you are absolutely correct that the trend we are seeing in RSV cases in the state right now, and honestly across the country, is unique. We haven't seen this before. If you recall last year's influenza season, we had very few influenza-associated cases or hospitalizations across the country. And the same was true of other respiratory diseases like RSV. And so we do believe that that could potentially be part of the reason that we are seeing more RSV cases now and seeing them earlier, in that we had such a mild season last year that that pool of susceptible individuals, which is typically very young children, is larger than usual. And so because of that, transmission might be occurring a little bit more readily than it would have occurred if we had seen a larger number of cases last season. And so I think there's some really complex infectious disease dynamics happening here that we're really trying to better understand. And I think we also have lots of questions about what this might mean for influenza in the next couple of weeks as well. So we're certainly going to be watching those trends closely to see if we see an unusually early influenza season. So again, another important reminder for the importance of influenza vaccination for individuals to keep that in mind as an important way that we can prevent at least those influenza associated hospitalizations. Unfortunately, we do not have a vaccine available for RSV, but we did actually send information out last week to healthcare providers across the state about individuals, young children that are at high risk of RSV infection. There is a medication that they can take during RSV season to prevent that infection. And so we wanted to inform providers that that medication might be something to start earlier this year than previous years to protect really those most vulnerable infants in the state.
Right, John Frank.
Yes, hi, John Frank here. Following up on the news that y'all had 75% vaccination the other day, I was struck by the fact that it took 2 months to just get that, 5% when it took 6 months to get to 70%. I'm wondering what's at work here, and do you expect the vaccination rate to continue to be so slow? Thank you.
This is Scott. I'll take that one. Obviously across the country, when the vaccine first became available, we saw huge interest amongst our population. And you're right, we got to the first 70%, pretty quickly. Comparatively. And as a reminder, Colorado was one of only 19 states to hit the president's goal of 70% of adults receiving their first dose by July 4th. We have seen rates tail off nationally, since the early summer. And our team, in partnership with local public health, is doing all that we can to continue providing all Coloradans with the information that they need about this vaccine. We're engaging with trusted providers such as primary care practices and pediatricians to ensure that they have the tools that they need to work with individual Coloradans to make the right decision to get vaccinated. We also have seen nationally and in Colorado an uptick in the last few weeks. I think as news about the impact of the Delta variant has come out, we have seen this increase. And really, I just want to reinforce again, while we have a number of different layers in our Swiss cheese model of preventing the spread of this disease, the number one thing that we can do is get ourselves vaccinated. This vaccine is safe, it is effective, it is free, and it is our ticket out of this.
Darius Johnson.
Hey, good morning. How are you? Darius Johnson from 9 News. I want to go back and talk a little bit more about the school screening that is free and voluntary for a lot of these schools. How important do you think this is right now, especially as so many school districts and so many parents are debating over masks and whether kids should be wearing them in schools? Some people are opting out, some are opting in, but this definitely seems like a way to be able to track a lot of these cases and really keep things at a minimal when it comes to classrooms.
So I'll take that one. And I don't know if it was my audio or yours. We're a little broken up there. But, I think what we just continue to reinforce in these conversations is the multi-layered approach to keeping our schools open and really working with our local partners and our local districts to ensure that they have all the information that they need and all the tools that they need. This school testing program is a key way to identify cases early, stop the spread before it can grow and become a large outbreak in a school. The wearing of masks, teaching our children to wash our hands, being careful about, gatherings outside of school. These are all strategies that will allow us to do all that we can to keep our schools open for critical in-person learning over the course of this year.
John Ingold.
Hi, everyone. It's John Ingold from the Colorado Sun. Question for Director Bookman. I'm wondering about ICU capacity And on the dashboard this morning, the data dashboard, it showed 13% of ICU capacity available compared to the 20% that you showed here. And I'm kind of wondering about why the discrepancy between those numbers. And then I'm wondering, of the people who are in the ICU right now, how many are there because of COVID, if you know that? And then how many people who are in Colorado ICUs are people who are transferred in from other states for whatever reason?
Thanks, John. There's a lot of questions there. Let me try to get to all of them. That 13% number is not a figure that I have seen. And so I'll need to track that one down. We have pretty consistently over the last month moved from about 72% of our ICU beds being occupied to this 80% number that we are at now. There are different regions of the state that have varying levels of ICU capacity. And so it could be that there's a regional view where we show only having 13% capacity there. I don't have information at this time on the number of out-of-state patients that are in Colorado hospitals. I had a conversation just this morning with healthcare leaders across the state about this subject. And what I think is important for Coloradans to understand is that we are incredibly lucky to have a robust healthcare system in Colorado, and that healthcare has really become a multi-state regional approach at this point, where states that don't necessarily have that capacity always rely on transferring their patients in to larger urban environments. And so our hospitals are working round the clock to take care of everyone in Colorado, whether they have COVID or don't have COVID, whether they have come in from out of state or whether they live here. We are monitoring this capacity on a daily basis and ensuring that we have capacity to take care of all.
Okay. And then how about Paulo?
Hi, this is Paulo Shalsla with Colorado Public Radio. Can you hear me?
Yes.
Yes?
Yep.
Okay, great. Sorry if I missed this earlier, but can you talk about the funding for the school COVID testing program, particularly if you're using federal dollars for this?
Sure, this is Sarah Hama, and I'm happy to take that question. So this is federal funding that was allocated to the state of Colorado, and we were allocated just over 173 million with the specific intent of implementing screening testing in K through 12 schools.
All right, that is going to wrap it up for our time this morning with Dr. Herlihy, Scott Bookman, and Sarah Hama. If you have any questions about topics that were not covered on today's Avail, or any questions that we weren't able to get to in the time we had together this morning, please email us at media_info@state.co.us, and we'll get back to you as soon as possible. We appreciate you joining up. Have a good rest of the afternoon.